Every 40 seconds, someone in the United States has a heart attack. By the time you finish watching this video, roughly 15 people will have had one. And most of them will say the same thing afterward. I had no idea. Except that's almost never true. The warning signs were there. Days before, sometimes weeks. Little things, a weird tiredness that wouldn't go away, a stomach that kept acting up, waking at 3 a.m. for no reason. Easy stuff to brush off, easy stuff to blame on aging or stress or a bad meal. And by the time the real event hits, up to 85% of the damage to the heart muscle has already happened in the first 2 hours. Most people don't even get to a hospital that fast. I had a 53-year-old patient, Priya, who sat across from me 8 months ago, 3 weeks after surviving a heart attack. When I asked her to walk me through the weeks leading up to it, she described 5 separate things she'd noticed and ignored. Every one of them was on this list. I'm Dr. Gray, and I'm going to save many lives after this video. Heart disease kills more people worldwide than cancer, car accidents, and violence combined. It's been the #1 cause of death on the planet for decades, and it still is right now, today, as you're watching this. But here's what the medical system rarely explains well enough. A heart attack almost never just happens out of nowhere. The artery that eventually gets blocked has usually been narrowing for months or years. And in the final days before the blockage becomes complete, the heart starts sending out distress calls. The problem is, those calls don't sound like what you'd expect. They don't feel like a movie heart attack. They feel like indigestion, like fatigue, anxiety. And that's exactly why people miss them. Today, I'm walking you through 8 of those signals, the ones that show up days or weeks before. So you'll recognize them if they ever show up in you or someone you love. Think of your heart like a water pump in an old building. The pipes feeding it have been slowly collecting mineral deposits for years. The pump compensates, works a little harder, pushes a little stronger. You don't notice. But eventually one pipe narrows enough that the pump starts struggling to keep up. When that happens, the effects ripple outward. Strange things start happening in rooms that seem completely unrelated to the plumbing. The lights flicker, the heating acts up, the building feels off. That's what happens in a human body when the heart starts losing its supply. You don't feel it in your chest first, you feel it everywhere else. Sign 1. A tiredness that doesn't make sense. You slept 7 or 8 hours, and you wake up feeling like you pulled an all-nighter. You used to carry grocery bags up the stairs without thinking about it. Now you need to sit down at the top. You're dragging by 2 p.m. even on days when nothing particularly draining happened. This is the kind of exhaustion that rest doesn't fix, because the problem isn't that you're tired. The problem is that your heart can't deliver enough oxygen-rich blood to keep everything running at full speed. So it starts rationing, and you feel it as this bone-deep heaviness that coffee can't touch. More than half of women who had heart attacks reported this kind of unexplained fatigue in the weeks before. Priya told me she'd been exhausted for about 3 weeks straight, blamed it on a busy quarter at work. Her husband said she needed more sleep. She was already sleeping 8 hours. But I'm not done. That's just the first one. Sign 2. Stomach trouble that won't go away. Picture this. A retired electrician named Frank. He is 61. He spends 2 weeks popping antacids and eating bland food because he's convinced he's got a stomach bug, nausea every morning, a heavy feeling after every meal, like the food is just sitting there. Nothing helps. His wife finally pushes him to come see me. I run a cardiac panel, and his enzyme levels tell me his heart has been under serious stress for weeks. 4 days later, he's in the hospital with a heart attack. 14 days of what he called bad stomach was actually his heart running out of blood supply. When the heart struggles, the digestive system is one of the first things that loses resources. Blood gets redirected to the brain and the heart itself, the organs that keep you alive in an emergency. Your stomach and intestines get put on the back burner. The result feels a lot like indigestion, heartburn, or a virus that just won't pass. Sign 3. Cold sweats at random moments. You're watching TV after dinner, and suddenly your palms are clammy, your forehead is damp, and you feel a chill even though the room is warm. You haven't exercised. You're not sick. There's no explanation. What's happening is that the nervous system has detected something wrong with the heart and flipped into survival mode. the same fight or flight response you'd get if someone broke into your house. That response triggers sweating. If it happens once, maybe it's nothing. If it keeps happening, especially alongside anything else on this list, pay attention. Sign 4. A tightness in your chest that shows up and leaves. More people get fooled by this one than any other sign on the list. A pressure in the center of your chest, not sharp, more like someone placed a heavy book on your sternum, that lasts a few minutes on a Tuesday and then completely disappears. Comes back maybe Thursday, gone again. Easy to call it heartburn or a pulled muscle, but what's actually happening is that a plaque deposit in one of the heart arteries is becoming unstable. It cracks, a small clot forms, blood flow drops temporarily, you feel the pressure, then the clot dissolves, flow returns, the feeling vanishes, until one day the clot doesn't dissolve. And here's what the medical community still doesn't emphasize enough. In women, this pressure often doesn't show up in the chest at all. It shows up between the shoulder blades, or in the jaw, or running down both arms. Priya felt hers in her upper back. She thought she'd slept in a bad position. She never once felt the classic chest pain. Sign 5. Getting winded doing things that used to be easy. Hauling laundry up from the basement and having to stop at the top of the stairs to catch your breath. Walking across a parking lot and feeling like you just ran a sprint. Lying in bed at night and not being able to get a full, satisfying breath. The heart and lungs operate as a unit. When the heart can't pump efficiently, fluid starts building up where it shouldn't, particularly in the lungs. The sensation is subtle at first. It just feels like you're a little more out of shape than you used to be. Sign 6. Sleep that falls apart for no reason. Suddenly waking at 2 or 3 a.m., wide awake, heart beating faster than it should, with this low-level anxiety humming in the background. Trouble falling asleep even after a long day. Research found that more than half of women experience disrupted sleep in the 4 weeks before a heart attack. The heart is under stress even during rest, and that stress bleeds into the systems that regulate sleep. If your sleep suddenly changes and nothing in your life explains it, you didn't switch medications, you didn't start drinking more coffee, nothing changed. That's worth a conversation with a doctor. Sign 7. Dizziness that wasn't there before. Standing up from a chair and the room tilts for a second, a brief wave where everything feels slightly off balance. The brain burns through more oxygen than any other organ, about 20% of the total supply from a body that weighs 2% of your total weight. When the heart can't push enough blood upward, the brain is the first thing to notice. Isolated dizziness has 100 possible causes, but new dizziness paired with any of the other signs on this list changes the math completely. Sign 8. A feeling you can't name. This is the strangest one on the list and the hardest to take seriously. A sense that something is wrong. Not pain, not a specific symptom, just a low-grade unease that sits in the background of your day. Some patients describe it as a feeling that something bad is about to happen. Doctors actually have a term for it, a sense of impending doom, and it's a recognized clinical sign. The theory is that the brain picks up on internal changes well before conscious awareness catches up, and processes the danger as raw emotion instead of a physical sensation. Frank told me about this. He said for about a week before his heart attack, he felt off. Couldn't put words on it. His wife noticed too. Said he seemed distracted and restless in a way she'd never seen. He ignored it because there was nothing concrete to point to. That feeling was his system trying to get his attention one last time before the event. Here's your prescription. Learn these 8 signs well enough that you could describe them to someone at dinner without looking anything up. Put this list on your fridge if you need to. The reason people miss these warnings isn't that the warnings are invisible. It's that nobody ever taught them what to look for. If you experience any combination of these, especially fatigue plus chest tightness or cold sweats plus nausea, call your doctor that day. If the symptoms are severe or sudden, call emergency services immediately. Every minute matters. The heart muscle that dies in those first 2 hours doesn't come back. If you're over 40 with any risk factors, high blood pressure, family history, high cholesterol, diabetes, or you haven't exercised in years, schedule a cardiac checkup this month. Ask for a stress test or a coronary calcium scan. Don't wait for the symptoms to decide for you. Priya survived her heart attack. She was lucky. The paramedics reached her quickly and the damage was limited. But she takes medication now that she'll need for the rest of her life. Her heart operates at about 70% of what it used to. Every time she comes in for her quarterly checkup, she says the same thing. 5 warning signs. I had 5 of them, and I talked myself out of every single one. Frank survived too, barely. 4 days in intensive care. He told me the thing that haunts him most isn't the heart attack itself. It's those 2 weeks of reaching for antacids when he should have been reaching for a phone. 8 signals. Most of them feel like nothing. A bad night's sleep, a weird stomach, a tiredness you can't explain. That's exactly what makes them dangerous. They're easy to live with right up until the moment they become impossible to survive. Now you know. The rest is on you.